Hi, everyone. My name is Paula Geraldo. I am part of the Community Health Training Institute team, and we appreciate you all being here today so we can talk about policy systems and environmental change. Next slide, please. All right. So what is CHTI? We are a partnership between the Massachusetts Department of Public Health and Health Resources in Action, funded by the Department of Public Health. We provide free trainings to individuals and teams, such as, trainings focused on coalition building, leadership, policy, communications, health equity, youth development, and, if you have any other suggestions, please let us know because we're always looking for more topics to discuss. Our overarching goal is to increase the capacity and skills of our community health leaders and partners to build and sustain coalitions and organizations that support healthy communities and actively address racism. We're excited to bring you today this free training on policy systems and environmental change, and that we hope that you'll leave it with a better understanding of what PSE change is, and with some strategies in your back pocket to implement the framework into practice to address health inequities. Just a quick note for those who have to leave the training early, please message our tech helper, Victoria, so she can send you our evaluation link. So you can message her or me. We'll both be there to help. And I'm now gonna pass it off to our wonderful facilitators, Allison and Cynthia.
Good morning, everybody. I hope you're doing well. Thank you for being here. Again, Cynthia Espinosa, I'm very excited to hold this space with you all today and related to PSE change. I'm just gonna run through what are we doing today, our sort of setting the tone for our time together. So, Victoria, if you can go to the next slide. So just quickly, a quick Zoom 101, as we know, we all may be on Zoom, but wanted to just uplift, if possible, to mute yourself when not speaking. You can share or stop sharing the video. You can also look at the participant option there to look at who's here, and the chat as well that we'll use for questions or to connect with each other. We'll be doing some interactive options here. We'll use, as you see on the top of the screen there of the Zoom, annotate, and we'll give more directions of that and your speaker view, so you can see us as speaking or the whole gallery. So I wanted just to give you a quick view of how to use Zoom for our time together. We can go to the next slide. So here's our agenda. We have 3 hours together, so we'll do our best to go through this and make this a fun, interactive experience. Again, we are gonna get to know each other and set the tone. We'll talk a little bit more about the objectives and group agreements. We are going to answer the question to the best of our ability of what is PSE change. We're going to share some definitions, benefits, and examples. We're going to do some small group activities to dive deeper into examples, and then we want to do a collective learning. So we'll have you all share out. Again, we're setting the tone to share some of the definitions and spaces, but we really want this training to be as interactive as possible. So we are going to welcome you to be here and be present. We can go to the next slide. So here's our goals for our time together. I'm going to give you all an understanding of how social and historical factors impact health, how systems and its structures maintain health disparities, and introduce you to a PSE change framework. Altogether, we hope to create a collective space and knowledge exchange on how to use the PSE change framework to address underlying causes of health inequities. We can go to the next slide. And we are going to start with some interaction here. So I'm actually going to call in another lovely voice from the participants if they're open to read out loud these group agreements for our time together. Any volunteers? If not, I might call on somebody, and I apologize in advance, but also want to see, let's see. Samantha Rhodes, are you with us and are you open to read this? Hi.
Yeah, absolutely. The first one only or all of them?
You can read one if you want, or you want to do all of them, and then we can pass it. Whatever you
Okay,
prefer.
I'll start with one, then I'll pass it. Be present and engaged.
Thank you. Any other volunteers?
Sure.
Okay.
Take space, make space.
Beautiful.
I can do one. Take care of ourselves.
Beautiful.
I can do one. Be flexible.
Grace and patience.
And brave space.
Beautiful. Thank you all for volunteering. So I wanted to pass here and see if there's any questions and any other group agreements that folks would like to add for our time together. And we'll scroll to see people's lovely faces. If none, you can get a quick thumbs up. We'll agree to follow these for our time together again. Beautiful. Thank you all. We can go to the next slide. Beautiful. So here we'll love to get to know each of you, and we're gonna use the chat feature. So we'd love for you to share your name, pronouns, your role and organization. And then here we're gonna sort of start brainstorming what are the things that you can come up with the acronym PSE. So I can model. So again, my name is Cynthia Espinosa-Marrero. I use the she, they pronouns. I'm a senior manager at Health Resources in Action. Other things that I could come up with acronym with PSC. One name, I'm a foodie, so it might come up a lot. So for the first couple of things that come out was P for pickles, S for sandwiches, and E for excitement. I don't know, it could be as silly or something very profound. So if you can put in the chat, again, all these prompts, that would be great, and we'll have folks read it. I can read it out loud, or you can read it there.
While folks are introducing themselves in the chat, I will also introduce myself. I'm the other facilitator for today. My name is Allison Scheifske. I use she, her pronouns. I'm the director of the Community Health Training Institute and work with Cynthia, Paula, and Victoria at Health Resources in Action. And because I was in another training and someone came up with it, and it's fall, people are like pumpkin spice extravaganza.
That's a great one. Thank you, and continue to introduce yourself. And again, we want this space to have you also connect and get to know each other much as possible. One thing I forget to name during the group agreements is feel free to, again, part of it is of the take care of yourselves. That could mean like if you need a break, buy a break, water, charger, whatever you need to be present at the time, please do that at any time here. Beautiful. Peace, serenity, and empathy. Those are great. Thank you all for engaging here. Oh, PSE could be platypus social engagement. That's a good one. Beautiful. Thank you all. So continue to introduce yourself in the chat. I'm gonna get rolling to the next part of the training. Love that. Positive social change. Beautiful. So we can go to the next slide, Victoria. We're gonna start quickly with a poll question that our amazing tech guru Victoria will pull up. We wanted to ask you all, how familiar are you with policy systems and environmental changes? You can share the results. Beautiful. So we hear this about 73%, about 22 participants out of 30 that did this somewhat are familiar with PSC changes. So we're hoping that today during our training and conversation and fun times, you get to learn a little bit and become a little more familiar with that, with the PSC changes and do the great work that you're doing. So now I'm gonna pass the mic to Allison to get us going on what is PSC change.
All right. Welcome, everyone. So glad to have you with us today to talk about PSE. Seems like most people have, somewhat of an understanding of PSE, but I'm glad that we are all here together to continue to dive into this. And we can, of course, we're going to have some breakout rooms. You can share what's going on. We can answer questions. If you have questions, you can come off mute. You can put them in the chat, anything like that. So let's define it. Let's define what is PSE change. So we have policy, right? These are laws, ordinances, resolutions, mandates. And we like to say that there's like big P policy and little p policy. So big P is kind of like those laws at like state governmental levels. And we want to make those changes. Those take a while, right? But there's also little p, right? Like what is happening in your organization, right? That can be a policy change. Right? So it could be like at your organization, it could be a policy between organizations. If we're thinking about like healthcare providers, it could be something about policies on quality of care or linguistic and cultural competency, whether it's trainings or folks who are like providers, things like that. So we want to make sure that we have both that lens of like big P policy and little p policy. And we can go to systems. So systems are improvements that include changes that impact all elements, including social norms of an organization, an institution, or a system, right? So types of systems include school systems, transportations, parks, etc. And this could be an example of like school lunch programs, like they put in salad bars and they took out vending machines, right? That is a systems change. So it could also be like a systems change of how do organizations work with each other, right? What is like the warm handoff referral system process to help get those better outcomes because of these systems changes? And then we have environmental, right? So the physical and material changes to the economic, social, or physical environments. So one of the big examples right now, if you've seen kind of the Robert Wood Johnson visuals, are about curb cuts. So when we go on and off a sidewalk, we have the kind of ramp down, and that's our curb cut. And that was originally made to help folks who are in wheelchairs, but it also helps for folks who are using strollers, who are carrying really like are pushing carts, kind of just it helps everyone, right? And that's an environmental change that has changed the kind of the physical environment, right? And so when we're making environmental changes, we want to ask ourselves, how do folks interact based on the environment? And how does the environment sustain and support their health? And with all of these, right, all policies, systems, environmental change, we want to ask, how do these changes last? Because a lot of us, myself included, come from a more program background. And so there's this difference between programs and policy systems and environmental change. So when we think about it, here's some examples up here, right? So the program's approach could be hosting a community bike ride, right? Or opening and maintaining a community garden. And these are great things, right? We do need to have these things. However, programs can end, right? With funding, with staffing changes, with space changing. We want to think about how can we make these last, right? Like the durable change outlast the funding, the staffing, etc. So when we look at those PSE change approach examples, instead of just hosting a community bike ride, we might want to implement a complete streets policy. And a complete streets policy means that roads are accessible to bikers, pedestrians, as well as motor vehicles, right? And so thinking about that. And sometimes we need the program to like highlight the issue to make that PSE change, but we always want to go to the PSE change. Do people have questions so far? Anything that people want to bring up and add? I know we just did a lot. We're gonna break it down even more. Okay. All right, well, let's get you all involved here. We're gonna do some annotate activity. So again, this is exactly what we just talked about. It's all of them on one slide, policy, systems, environmental change. And we're gonna go into an activity.
So, on the top of your screen, you'll see, this is Victoria and the math sharing. You're gonna see 3 little dots after the name. When you click on that, you'll notice the annotate button. So I want to give it a second. Okay, thank you, Paula, for also including it in the chat. So once you see that, you'll see sort of a bar with different options that you can either put a text. I'm gonna write it here. Hello, this is a message that I'm writing here on the screen itself. Can you all see it? No? Let's see.
Oh, there we go. There
There
it
we
is.
go. I have to click it. So you can also draw, so, and you can pick that. I'm gonna do a little quick smiley face. You get to see my not that great drawing skills. So we want you to use this to either mark or check these examples. We have a couple of slides with different examples of whether it's a program or PSE change. Okay, do folks know how to use annotate? They have it open and ready to.
So there is a stamp function. It's a little star, or you can choose other things like a heart.
A question mark, an arrow. Let me put the heart. Look how cute. Beautiful. Folks are ready. Awesome. And if you do unable to open it up, feel free to put it in the chat and we'll add it here. So, is this a program or PSE change? The city council creates a resolution that funds a city bike service so that people can ride for free. A PSE majority, some program. Beautiful. I'm gonna give a second. Let's put program. So for this one, it is a PSE change. What we're looking here is, this is a specific policy. One thing when it comes to policy is you usually have a body of decision makers, like a city council, town council, board of selectmen. That they're the ones creating a law. So this is a policy that they created that then supports a program, right? So it could be a little confusing when it comes to the piece itself. So the bike service, people are riding for free, is a program. However, that program it was created because of a PSE change made by the city council. So I hope that helps to give you a sense of how that works out.
Yeah, this one was a little confusing to start off with because you're right. If you didn't create that resolution that funds it, then it would just be a program. But because there's something like that resolution behind it, so it's supposed to keep funding it, that's the PSE change. But let's go to the next one. So let's clear this. Go to the next one. Yeah.
So I'm going to read it out loud. A local youth work organization holds an outdoor camp every summer to teach young people about the outdoors. Beautiful program, all the cute annotate things. And yes, you all lean into the correct one. This example is a program. It's a very exciting program. It's something that we definitely, I feel like as a person that loves the outdoors, wants to support and do. So again, this is an organization that's doing programming specifically, is not doing PSE change, but it could potentially lead to that, right? You can learn from youth, things that relate to the outdoors that might not feel or be safe, maybe there's some trails that need to be fixed or some et cetera, things like that. So again, a program can feed what PSE changes may happen or may need to make it happen. Great. So we'll go to the next example. Local businesses on Main Street, any Main Street, right? We'll pick any town, put signs up in their windows, encouraging people to walk and shop instead of drive. In the middle, I like that too.
I'd love to hear from some folks. This one is a program change. But I'd love to hear from folks like, what would make this a PSE change? Like, what would we need to do to make this a PSE change?
I viewed it more, this is Margie, sorry. I viewed
Hi,
it more
Margie.
as an advocacy piece, right? So like maybe as Cynthia said on the prior program, like it feeds into that piece. So I was looking for more character when I read it. I was like, well, yeah, so what part of advocacy are we part of? Like what group are we working with? So that's why I went into PSE change because it's not a standalone. So that's where my thinking came.
I love that thinking. And you're right. We gave you a sentence to work with. There's a lot of questions behind there. So the actual act of putting up signs in their window, definitely advocacy, but it's also considered more programmatic than PSE change at the moment. But Rusty, I think you had your hand up. Did you want to add in?
Yeah, Carrie Gallant beat me to it in the chat. I'm like, the policy change that would make this PSE would be like removing some of the on-street parking or an ordinance that gives back, as like in Northampton, there's a street that since COVID is just restaurant seating. So it's like stuff like that would make it PSE.
Amazing. Absolutely. Caroline, you put it's an awareness program. Yes, absolutely. It is an awareness program. And like Rusty just said, if the PSE change that we're looking for is like, we want this street to be a pedestrian walking area only, right? That would be the PSE change. And perhaps the businesses are putting those signs up in support of that. Other thoughts on this one? All right, we got another one.
So, we got one. Can go to the next one. Okay. Youth at the your town's middle school successfully petitioned to get the soda vending machines removed and replaced with healthier options. Is this a program or PSE change? Mhm. Yeah. So we're all leaning to the PSE change, and it's exactly that. Again, it's a systems change of removing and changing the physical systems and just options of food for the youth, which is exciting. Yeah. Any questions or anything to add, Allison?
Yeah, I was gonna say a lot of PSE change does start with programs. So, thinking about they successfully petitioned to get those soda vending machines removed. So that's that systems change in PSE. But the program beforehand could have been something like, you know, um, a health class with like talking about like the benefits of those healthier options, or a cooking class or something like that. So thinking about some of those programs and how they help to lead to PSE changes sometimes.
Good for that. Any questions or any other thoughts folks had? Good. Now we can go to, we got a couple more. Okay. New city parks are designed with both biking and pedestrian pathway. Mhm. Mhm. Beautiful. Yeah, it sounds like well, most of us are leaning, yeah, to a PSE change, so it is an environmental change itself of the physical design of parks that include pathways, again, to make it accessible for both biking and pedestrian users there. Mhm.
And again, there's nuance to this one, right? Because it's that new city parks are designed with them, right? So it's that is the environmental change versus let's just put a pedestrian path and like put it through this park that already exists. That's not PSE change. So I wanna like very clearly call that out because we want to like as we're approaching like here is a new way of thinking about parks. We are making it our policy, our practice to do this.
And would name too that working in formerly municipalities and looking at those, what are the policies, why, how does this design even happen? Many of these probably became part of planning the documents. Again, these are what we mentioned earlier, like a police streets ordinance, which is a statewide ordinance that make sure that all street designs are accessible, and then parks have open space and recreation plans that include that as well. So sometimes there's a policy that leads to environmental change, and then from environmental change again leads to sort of like more big P or little p policy changes there. Any questions or comments or thoughts on this example of something that comes up for you? If none, we got one more sample to go through. A bike repair shop holds a low cost classes on riding safely. Okay, let me give a couple seconds. Alright, so yes, it is a program, and also I like the start in the middle too. It can definitely lead to a potential PSE change as well. This is again a program that is a class, which is very exciting, something that's needed, right, for bikers and for folks to learn how to ride safely on the streets, vacations, etc. And that could also again feed the feedback, the potential needs and interactions that you have with folks in classes can lead to potential needs in the community for policy systems or environmental changes. Any questions or thoughts on this example? If none, we're now gonna give you all some chance to interact with each other so we can go to the next slide. We're gonna do a quick poll question, of course. We wanted to find out from you if you're currently implementing policy systems or environmental changes in your community. We'll close the poll. And share. So majority of us, yeah, they took the poll are implementing PSE changes. We have some folks that are not, which is great too. So we're very excited to say, yeah, and little P's count. So little P's that you're implementing are part of it. So thank you all for taking the poll. We are gonna move to the next slide. So we wanted to give you all some space to come together and chat. We're gonna do small breakout rooms for 4 to 5 people per breakout room. And we wanna give you all about 10 minutes to, introduce yourselves to each other, but also answer this question, like what are the benefits of a PSE approach? And then we'll share out just highlights of the conversation that you will have related to the benefits of PSE approach. Any questions on what we're doing next? I am gonna cue our amazing guru Victoria to see with your groups. There you go. So join your groups and enjoy. Bethany, go for it. You are muted, so we're not able to hear you. Part of soon.
It's okay, I was just getting warmed up. So Ariel and I kind of worked together to develop the idea of like equity and access, and the fact that if people are developing just programs, there will always be folks who can't access them, as opposed to if you take a more systemic approach. I think Anina specifically said that it promotes long-term change, systemic change, as opposed to only a few people being able to access a more short-term program, as opposed to an equitable access for everyone to a long-term PSE shift.
Anyone else from another group? We had 8 groups, so we'll love to hear from 6.
Hi. I was in room 6. Am I okay to go?
Yes, you're okay to go. Go for it.
Okay, so it was myself and Sherelle and Krishna from New Jersey. We were in room 6. And we discussed a benefit of more consistent equitability across the different dynamics of regions where you can have rural and inner city pretty close by to each other, and having collaborative efforts work successfully and being more equitable and consistent in servicing those various populations that can differ so greatly through policy and systems and environmental change.
Thank you all so much. Any other groups? Viviana, you can go for it.
Hi, everyone. So the conversation we were having in our group is that policy can benefit communities, but the other flip side of that is that policy can also harm communities. So in our group, the person, Catherine, who was sharing this example, was saying, like, you know, racist policies have harmed communities for many years, and we can also implement good policies. And then Nancy was sharing that she worked at the planning department, transportation planning, and that sometimes you have really good strategies about implementing strategies to change the environment, but they take a really, really long time. So it might we see the same thing in Revere, where I'm calling you from. We have a bike and pedestrian subcommittee, and we're talking about things that are needed, but they might not come until 5-10 years down the line when we align everything and the funding comes. And I think the reflection I'm having today personally about PSCs, I have heard this conversation a lot, but I always feel like there's something new to learn. So that's why I'm here. But what strikes me today about policy, system, and environmental changes is that while they seem to have a more permanent impact, all of them can actually be undone. You know how they're saying, like, with programming, you know, funding ends, but I think policy can also be undone. Like in Revere, we're very much an urban city, and before, people couldn't keep chickens and people were keeping chickens. So we needed to change the policy to create the regulation so that people can keep it in a manner that was safe for them, for their animals, and for the neighborhood. And I think the same thing with like system changes. I think we can undo systems and redo them. So I think there's always this influx. And even with like environmental approaches, like if you're redoing streets or redoing parks, all of this needs maintenance and constant upkeep. So I think there's also like, you know, it's also interesting that while we say PSCs are longer lasting, they also have a lot of flexibility built into them.
They do. And we're not saying that PSE is permanent, right? Because PSE should be growing and adapting with new knowledge, new needs, etc. So like the example that you just brought up about like having chickens in Revere, that needed to be redone, but it was replaced with a new policy. So there's the other aspect of it, is that when you're changing policy, you're changing it by creating new policy. And same thing with systems and environmental. So that's what we want to keep in mind as well, is that we are updating policy with policy and systems with systems. But yes, they do need to be updated and changed, right? As we learn new information, as we replace racist and other harming policies and systems and environmental things that were in place. So yes, but that is a great point, because I think right now it's especially coming to mind. There's been in like local well, also in Revere, right? Like whether or not y'all are gonna repeal the ban on places selling marijuana, right? Yeah.
Yeah, that's a great example. I didn't want to talk about this because I feel like this is more mass in motion, but that's another,
Right.
that's what's on my mind right now, that we had a protection that we were not gonna allow the marijuana industry into our communities. And now the city council is looking to change the policy to allow recreational marijuana. And so we're thinking about the health impacts of that and
Yep.
who benefits, who is harmed. But that's what I'm saying, like sometimes you think you're changing policy for good and then a new legislation or council comes in and they can undo all the work that you have done. So things are always in influx. Sometimes we're improving policy for the better, and sometimes policy is detrimental for the people that live in the community.
Yeah, it is. It is in flux, but again, the goal is that, you know, you have the policy and that it outlasts what would have been a program, right? And that it can be changed. And we have a bunch of stuff in the chat as well. So y'all really put lots in here, like you know, that we do need to be aware of unintended consequences of PSE change, and y'all are like skipping ahead to the next part of the presentation where we're going to talk about all of this. But that it is supposed to be more sustainable, right? Because, you know, for those of you who are working to create change, right? You might not always be in that role. Or like Viviana said, like roles change, governments change, but how can we try to have something that lasts, right? That is more durable.
I shared, sorry, this is Marjorie.
Yeah.
I don't know what our group number was, but I was
That's
with
okay.
Melissa and Patricia and Karen. So I shared a little bit about how I fell into PSC, and then it was organic development based on the work that we do. So I'm the director over at Voices of the Community, and our goal is to really look at who is it for and why, who's it
Yep.
intended for, who are the systemically excluded populations, and where are they in the decisions that are being made for them, and how do we build them into the processes of decision, whatever it may be, right? Boards, advisory committees, policies, wherever it is that's impacting them. How do we connect and build bridges for people to be part of those processes? And then inadvertently, I was sharing that when we were doing this work, it was organic development. We couldn't project the outcome. And I had no idea that what we were doing at the time was PSC, right? It's like, here's what they're sharing. Here's what they said. Here's how we work to connect them. We didn't do the work for them. We worked and build trust with these communities and help them to connect to those spaces and build a change. And I gave an example. One was just a concerned mom needed a light at the park for safety. That's all she was asking for. And it took us 2 years and connected from one mom to like 30 moms. And then it was, who does it go to? Does it DPH? Is it Parks and Rec? Like, no, like the city was like going back and forth with us kind of thing. And then we built this little group that they continued to do this on their own. And so it trickled into schools, with busing, all these other things. And so I wanted to share that sometimes that transformative change in PSC for the long term is really building in the core root of who's it's impacting and making sure that they're building that connection throughout. Because as it evolves, that it changes, if these people who it's impacting are always engaged in the conversation, then the PSC will always be in the best interest of that community, right? So I just wanted to highlight that.
I appreciate that. And we're going to talk a little bit more about that in the next half, but you're absolutely right? We need to bring in the community and the voices of those that this is going to impact. Anyone else have any other benefits or things that they want to share right now?
Was there any questions that came up in your group
Yeah.
that you want to bring up to everybody here, to us?
I wanted to talk more about the role of PSC in media, because there's been like very effective PSC approaches that did not get implemented, and they caused enough conversation that something did happen anyway. Like the one that I had thought of was like Ruth Bader Ginsburg and like the Equal Rights Act, the ERA. And that had like a huge national impact, but it was rejected. So I was kind of curious also about that because I know we talked a little bit about like the flip side of PSE. It's so effective that it's a little bit dangerous. And we kind of like how to capture the red flags when someone's implementing a PSE and it's going to be like a problem. Because I think we have like ignored a lot of like system changes that we thought were like small things that we could just like let pass, and now that's like the system we're in a bit. So yeah, but I don't know. Sorry, that was like a kind of melange of things, but
That's great. So let me just try to summarize and see if I capture your question correctly. It's more of a question of a PSE change has a lot of media backup and like awareness, right? But then it doesn't get passed. Like, what is sort of that process like? And you give that example, did that capture correctly?
yeah, well, I mean, just more like, is there ways to leverage media in order to pass a PSE? Because like we're talking about policy approaches as if they're all internal when like these are actually like these can be externalized and like shared things. Like, we were talking about bringing in the community, but like it could go a lot further than that. It could be like a ProPublica article suddenly.
Yeah.
So it's like I'm just curious, like do you guys talk about that in your
Yeah, I'd answer that and then I was gonna pass it to you. I think you have to have both, right? You have to have both the engagement of community of those who are really impacted by that to really help lead and feed what that looks like, what PSE looks like. You need sort of all different players, right? It's more than one group that's making the decision or the one group that's designing it. And media definitely plays parts of it. And many PSE changes, again, started with programming that looked very different from arts to advocacy to et cetera. That then led to PSE changes. So you need a lot of players for that. And sometimes that might take a while to build the trust of people, including the decision makers, whether it's town council, again, different departments within a municipality to make that happen. And I feel like that's what takes the most time of building those trust and relationships from all the different players, right? Because they'll want to see the benefits and they might have a stake on it to then pass it. So that's why PSE takes a little longer. And I think, yeah, media is a key player of that. Being able to tell the story and story narrative of all of the benefits, but also from different and diverse groups and community members that again will be impacted, those who are in power, how they feel about it. So it's like, it is definitely part of can be a part of a campaign like many do it or advocacy, but also story, like what is written in the policy or how systems are done. It also makes it fun and complicated at the same time when you try to make PSE work for that.
It is. I think that you're talking a lot about strategic communications, which is a whole separate training, but very important, right? So when we're thinking about PSE change, like Cynthia said, we have to figure out what that approach is. We need to figure out what the message is, who the messengers are, who the audience are, and figuring out how we are framing that in the communications to folks. Media likes a compelling story, and PSE change, the way that we've traditionally talked about it, isn't always that compelling, right? It doesn't latch on to an individual and it's like their story. It's much broader than that, right? We want to figure out how to talk about the collective community impact of a PSE change. And so, there's a whole lot of strategic comms that we could go down, but really that's a separate conversation and training, which I do recommend you all, find out to do that storytelling and that narrative writing and like how do we identify what we want to say, how we want to say it, why we want to say it. It's just, it's very important to communicate PSE change. And particularly when you're involving community members, because PSE change takes a long time in some places, right? So, if we're trying to make this change, like you just brought up that there was an example about like it took 2 years of going back and forth, right? That's what Margie was saying. Some folks like they're coming in like, oh, that should be done next week. And ideally, yes, but it's just kind of not the way that our systems are currently in place. And so it's also setting up those like beginning expectations through communication with the community members. Does that get to your point, Natalie?
Yeah, no, that I'm like this. Sorry, I brought up like kind of a different part. Like I vote in Georgia is like maybe why I think about it this way.
No.
So yeah, that's super interesting. I'd be really interested in the strategic comms training as well. So I'm going to be looking out for that. But thanks so much, Allison and Cynthia.
Yeah, absolutely. Communications is key, and we don't go too much into it in this training, but that could be another topic that we come up with here and offer.
Any other questions or other groups you want to share? Any highlights? We're gonna move forward to our more talking about upstream versus downstream. Not sure if folks have heard of this, so we'll go to the next slide.
Okay. All right. Has anyone ever heard of upstream approach before? You can give me a thumbs up or down, real thumbs, fake thumbs, anything like that. Okay, a few folks have heard of it. So there's kind of a story that goes along with it as you're walking along a river and you see a baby in there and you're like, oh my gosh, like you run in, save that baby. Pull the baby out, they're good. You're like, oh, all right, phew. And you look back towards the river and there are 3 more babies floating down the river and you're like, all right, here we go again. You go back in, pull out those babies, they're good. And at this point, you're like, what is going on, right? Why are all of these babies floating down this river? And you are going in and saving them. That is a lot of effort, right? So we want to figure out, we want to go upstream and figure out what is going on. How can we prevent these babies from being in the river? So we want to do a few things here, right? We want to keep saving those babies that are coming down the river. And how can we send someone up there to be like, go figure this out, right? We gotta prevent this. Okay. So when we go upstream, we are looking for kind of reforms for fundamental social and economic structures, right? We want to address the root causes or the underlying factors. And so, we're talking about saving babies in rivers, but we could be talking about like, we got a lot of kids with asthma in our community. What is going on? Why are those numbers so high? And going upstream there to be like, what's going, like, what needs to change? What PSE thing can we change? Victoria, can you go to the next slide? Right? So we're talking about these upstream approaches, right? We want to reform the fundamental social and economic structures. Downstream approaches are those interventions that seek to address the immediate needs, right? We're saving the babies in the river. This is a more reactive approach. This is also usually a more programmatic approach. When we think of if we think of after school programs, a lot of those programs were formed in reaction to things that we deem to be issues, right? So they started with funding, with staffing, with an idea like, okay, we want to prevent XYZ because it's happening. Let's make a program instead of like, how do we go above this? And if we have a lot of youth who are smoking, right? So then we're going to institute a program to be like, let's not smoke. How do we make the policy of like, okay, we've raised the age to buy cigarettes to 21, right? To make it harder for them. Questions on upstream approaches. And exactly, Carrie, it's treating the cause, not the symptom. And actually, yeah, go ahead.
Want to iterate, like, again, all these approaches are needed, right, for addressing any health disparities in your community and the work. Many of you are probably in coalitions or know folks that are doing, again, those downstream approaches, which is programs and all that, or you might be that. And again, you will play a big role, all of you play a big role in really feeding what PSE looks like for that approach that you're doing. So wanted to name that too, that it can influx, right? You can start with an idea of a PSE, but then you start with a program. So, and again, the ultimate goal is to really go upstream, to approach that and sort of look again at what is the cause of this health disparity, what's the cause of this specific issue or thing in the community to then address it. Karen, you have a question?
Yes, thank you. Sorry if I missed you describing this, but could you just elaborate a little bit more on the midstream approach and maybe what an example of that looks like? Thank you.
Yeah, absolutely. So midstream approaches are, midstream, right? They're trying to reduce like exposure to health risks by improving like living conditions. So an example of this is if we use our like smoking or an asthma example, right? So downstream, if we have a lot of youth who have asthma, downstream is, okay, we're gonna provide them medical care, get them the inhalers, see the doctors, et cetera, that they need to do to be okay with asthma. That's downstream. Upstream is we need to like redo policies on our schools, our housing, etc., so that we don't have like, mold and asbestos in our buildings, for one example. In the middle of that would be like one housing complex that institutes like no smoking in the building. Now, I know you're not supposed to smoke, but like that's the example there. Is that clear? Okay. Great.
Thank you.
Any other questions on upstream approaches?
With that same example, so you gave like downstream where you're like, okay, here's medical access, and then midstream, it's like, here's some intervention ways and policies to implement. What would be an upstream for that example?
For this one, like changing the housing policies, so like when they're
Got it.
built, they're not, or being rebuilt, so they don't have mold, asbestos, etc. Kind of all the things that we already know that prevent asthma, like, but we're putting them in a policy so that like when new construction is being done, or when things are being like retrofitted, things like that.
Got it.
Okay. Madeline, you
Thank
say,
you.
can some policies be both downstream for patients, maybe upstream policy for staff? Could you elaborate on that a little bit more?
Like there could be changes to, let's say like psychiatric holds, like that could be a policy which affects patients, but then like maybe they're, I don't know what the policy would be, but like that could end up streamlining staff processes, or it could end up complicating them. So like, I'm just thinking of like ones where it depends who you are if this policy is like better for you. Cause yeah, I don't know. Because like staffing is such an issue across all these sectors. So like how do we also like leverage stuff to keep people working for us or like with us?
Yeah. I think the way that upstream and downstream approaches are, it's more like reactive, proactive. So oh, sorry, go ahead.
Oh, no, I'm like, sorry, I'm just listening.
Okay.
Yeah.
So like, are you meeting immediate needs versus like reforming things? Can they be both? Potentially, but it would be a challenge, I think, right? Just because of the way those are framed. The policies themselves could have, like you're saying, have different like impacts on patients, staff, etc. So those need to be thought through, but whether or not they're downstream or upstream is usually clearer.
Mhm. Okay, that makes sense. Thanks so much.
If there is that confusion, you're probably midstream, right? Where like you're trying to make a change, but it doesn't apply to like everything. So if you're thinking of for example, if you're thinking of like a hospital system and one of the hospitals is making an upstream change, but that like impacts, say, like the referrals to the rest of the system. Is that like, I don't know if that's a good example of what you're talking about.
Yeah, no, that's a great example. Just because we have something that's kind of like we use Find Help if anyone in this room is like familiar. I don't know, but it's essentially like a resource finding like single point of entry. And so like I'm kind of thinking about this like with staff adopting this versus patients or for us clients, but like this system is also integrated into Epic across a bunch of like systems. So it's like kind of that's why I'm thinking of this.
Okay, so
Yeah.
I think what you're really getting at is that people are like at different points. Like the policy
Yeah.
is not consistent across all of the points that it needs to be across. And so that requires further change, right? That might require systems changes, so that things are across everywhere.
Mhm.
Okay, but the way that is written or the way that it is implemented is usually like it's either downstream or upstream. So if we go with this like referral system again, it's not being implemented across, that requires a systems change still, right? But we are looking more upstream in the referrals change because we're trying to reform that process and like distribute better access to health for everyone. Is that?
Yeah, that makes total sense. So
Oh,
thanks so much.
of course.
Again, we want to name that upstream PSE changes is really looking at how do we create an environment, right? That is physical itself or like in general systematic environment or policy that helps to reduce poor health outcomes, right? At any level. So part of the goal is again, knowing that there might be some behavior, some things or health outcomes that your community may be facing that you are working towards directing or approaching. It's sort of asking like, what is leading to that behavior? What is leading to that health outcome? And what is upstream that is in place to make that happen? So taking it upstream is really digging into more of that and how else, that impact is impacting their living conditions, behavior, diseases, injuries, and mortality itself.
And actually, if we go to the next slide, this is a little bit more of a visual of it. So the social inequities, that's upstream, right? And so then the mortality is downstream. So if we, want to prevent something in the disease and injury and mortality, then we need to work upstream to help prevent that. So Victoria, can you go to the next slide? So working in PSE change, if we want to prevent disease and injury, we need to go up, right? So we're going to go to like the laws and regulations. So if we're thinking about reducing increasing physical activity, right? Reducing low activity, then we probably need to make changes to the physical environment, which means we need to make laws and regulations to do that. right? So this is just one example of like how these connect, but you can do this in many different ways.
Incident here, this makes me think, as a parent who may have a younger child, that they ask the why question, this is where it comes in handy, you know. If people have chronic disease, you know, why is that? Sometimes it's the low physical activity. So why is there low physical activity? It could be a lot of the living condition parts of it, from physical to social, etc. So here we're looking into the physical environment. So it's like, why is the physical environment the way that it is? Because of laws and regulations. So again, thinking of like the curiosity and asking the why could be a great example of going into that with the mind of being open and not bringing the assumptions of this is why a person is doing X, Y, Z. It's really looking again upstream. Why is and what is causing those risk behaviors, disease and injury or mortality itself. So this is another great example that has helped me with my work with PSE of that curiosity and yeah, being open on that curiosity of the whys is happening. Any questions on this this example or just the conversation related to upstream versus downstream? Yeah, we want you to sort of marinate this. It might be a lot of information and might feel a little confusing, and that is okay. We hope that, again, this is just to introduce you some frameworks of that. We're actually gonna now go into a break, so we'll give you about 10, yeah, 10 minutes. So it's 11:21 now, so we'll come back at 11:31.
When we come back, we're going to move into health equity and social determinants of health and how those connect with PSE change. But go grab a snack, some water. If it's nice out, stand outside for a moment. We'll see you back in 10 minutes.
Yeah. Thank you. So I'm going to pass the mic to Allison to take us through the next part of our training.
Yes, so we are going to use, we're going to talk about substance use and some data there to get into PSE change and health equity. So on the next slide, I have a graph and I want to hear from you all, like, what do you see here? Like, what is happening? So this is the, excuse me, rate of confirmed and estimated opioid-related overdose deaths from 2000 to 2022. And so we have the years on the bottom, and we have the rate per 100,000 residents on the top, or going up. And so what do you see? You all can come off mute, you can put it in the chat, but I just want to hear, what are you seeing here? Yes, an uptick during COVID, absolutely. So we see it start rising again in around 2020. Yep, the COVID pandemic certainly compounded the opioid crisis. What else do we see? Oh, such a good question. Was there a policy change in 2016? Because in 2016, we can see it start going down a little bit. Does anyone know what happened around then? There was something that happened. Anyone want to take a guess? Change in government. Well, there was a change in government. That is true. Yes. So in 2015, naloxone was first approved by the FDA and became available as a nasal spray. Yes, Narcan goes generic. Yes. So you see this slight decrease because of the availability of Narcan, of naloxone, which helps to prevent opioid overdose deaths. Yes. And although this data stops in 2022, last year in 2023, the FDA approved selling naloxone without a prescription. So you're starting to see it more in more places now, right? Like when I go into a public restroom in a few different places, like I have seen them on the shelf in the bathrooms, which is amazing. So we'll see how that reflects in the data in the next few years. But you see this rise, and as Catherine said, there's a disturbing upward trend, and there's definitely due to fentanyl. Fentanyl has increased. It's present in many of the fatal opioid overdoses. Anything else that people see here? Let's bring in. Well, let me change the question. What does this graph not show?
Demographics, geographics.
Yes. Yeah. Doesn't show demographics, doesn't show geographics overall. It doesn't tell you, for example, like rural versus urban, right? Doesn't tell you the rates by race or ethnicity, gender or age. Absolutely. Doesn't tell you that actually the opioid overdoses have been going up now for ages 35 to 44, where it used to be in the 20s, in the 20s. Right? So this isn't showing you that like who the largest group is being impacted by this, right? And so it's Black non-Hispanic men have had the highest related opioid deaths, and it's been a huge increase, right? It went up 42% in a year, and nowhere on this graph does it show you that. So when we're thinking about what this graph doesn't show, we're talking about health disparities and health inequities. Victoria, can you go to the next slide? Okay, so health disparities are the differences in the incidence and prevalence of health conditions and health status between groups of people based on these things. And you all named most of these things, right? And so we are not seeing that in some of the graphs that are being presented, right? So if we go back to like, we were talking about media and how PSE change is communicated, it is really important like what data media picks up and how it's presented. So can we show some of these health disparities? And we're also talking about health inequities. And so on the next slide, we have kind of the definition. It's the difference in health outcomes that are systemic, avoidable, and unjust, right? And so when we think about opioid overdose deaths, 42% increase among Black non-Hispanic residents in Massachusetts, right? That's a huge increase from 2021 to 2022. Like we need to be talking about that. And so it like that graph doesn't show that. And so our goal when we're talking about PSE change is to have health equity. So we need to take steps to address these health inequities, these health disparities when we're thinking about PSE change. So can you go to the next slide? Okay, so we want health equity, right? It's achieving the highest level of health for all people. And this takes us upstream, okay? And keep going. Okay, so when we want to think about steps, we want to desegregate that data, right? We want to see it by race, ethnicity, age, gender, everything, right? We want to see geographic location. We want to actually have that analysis, right, on race and power. We also want to have it on poverty, right? We want to surface those disparities so that we can address them. We want to ask questions. Cynthia before was like, why, right? There's like the 5 whys in a root cause analysis. You keep asking why because you need to, right? We are going to talk about the social determinants of health in a moment, right? So we're going to connect those in here. And all of what we want to do here is go upstream, what we were talking about, right? And when we're doing that, and you all talked about this, we want to build strategies. We want to make PSE change informed by those who are infected, like led by them, voiced by the community. Okay. So we've talked about PSE change. We just talked about health equity a little bit. We're going to talk about social determinants of health, and we're going to put it all together.
I just wanted to pause and see if there's any questions related to the health disparities, health equity. Piece. I hope that it all makes sense again. We're working towards health equity, and we wanted to quickly do a refresh of how social determinants of health are part of the PSC strategy and design, but also how it leads to health equity. Have folks heard of social determinants of health? See nods, yeah. So the famous acronym SDOH. There's a lot of acronyms in our work. Great. So again, we want to give a refresh. These are conditions in the environments where, where people like ourselves are born, live, learn, work, and play, worship, or age that affect the right range of health, functioning, and quality of life outcomes and risks. So the social determinants of health are grouped into 5 domains. Oh, and thank you, Allison, for putting in the chat the link of the article of the data that was shared so that you'll have that. Great, so we can go to the next slide, Victoria. So the first one is economic stability. This is where a lot of groups, organizations, everybody in the community is working on this, which is looking at, increasing employment or keeping it, et cetera. A lot of projects, PSE working around that. Food insecurity, I imagine many up here have worked on that. Housing instability, addressing those, and then poverty. So that's sort of a domain of social determinants of health. Are there any folks that work in any of these categories that are on the screen? Where there's working on employment, sorry, food insecurity or addressing that? You can raise your hand. Yeah, awesome. The next one. The next domain is education. So this is a lot on early childhood education and development programs, policies, institute systems, etc. Higher education, enrollment, and as most recently, those state policy. Does anybody know what state policy related to higher education passed in Massachusetts? Quiz time. Anybody who would like to share? You can put in the chat or you can unmute yourself. Don't be shy.
The free tuition.
Free tuition. There you go. Free tuition at community colleges. So again, that's a way to address social determinants of health. High school graduation, a lot of programming and support on that, and then language and literacy programs there. Awesome. Anybody working in any of these this domain? Yes, see some thumbs. Awesome. The next slide. This is social and community context. So this is civic participation. Could look like different advocacy work, neighborhood associations, etc. Working against discrimination and looking at PSE and that. Incarceration, again, looking at programs that help current incarcerated or formerly incarcerated individuals in the state or community. And then social cohesion, again, this is where you want to have that spaces and looking at both environment, systems, and policy that could support social cohesion overall. There. And Margie, yes, the information will be shared. So just one in slides will be shared in the recording. So thank you for being here and your participation. Anyone working, you're welcome. Anyone working on this domain of social determinants of health? Yeah. And you might work in more than one. So that is okay. We can go to the next slide. Health and healthcare. So again, access to healthcare, primary care, and then health literacy, really teaching others anything and everything about that. Anybody here working in the healthcare domain as well? Beautiful. And then the next slide. So neighborhood and built environment. So this could look like access to foods that support healthy eating patterns. Again, if I want to be healthy, but but I don't have access to a grocery store near me, you know, may live in a food desert, as many do know. Working on access to food is part of sort of the social determinants of health and built environment piece. Crime and violence, really looking at how crime and violence in a community affects all of the health outcomes related to that. Environmental conditions, again, this comes into whether asthma, do you have enough air, you know, air pollution, et cetera, that comes up from that. And then quality of housing. That is big and key and important there, from programs that help and policies that help about, and laws specifically about lead reduction in apartments or testing, and the protections that you can have as a tenant as well on that. So that all looks like that. Anybody here working on neighborhood and built environment work? Yeah, awesome. So I wanted to give you a refresher on the social determinants of health. We can go to the next slide. There, and part of that is piece of what we call the health equity tree, the equity tree. Has folks seen this tree before, or a version of this visual? Yeah and no. So this is just a visual piece of looking at how health equity and sort of looking at how all of the pieces play together when it comes to the health outcomes that we are trying to address, right, in our PSE programs, and specifically now for this training, the PSE, that we have to go down to the roots and also the soil, right, of what's feeding the tree. So we're going to use this this example of a tree. Many of us may be working, and I know that a lot of the work that I've done has been related to like heart disease, right? And that could be part of the health behaviors that might lead to that health outcome, right? It could be diet, it could be lack of exercise. But we know that's like just, again, the surface, that's part of it. There's more to that. As I mentioned, and we'll give myself an example. I come from a family with a lot of heart disease, chronic disease, you know, high blood pressure and all that stuff. Diet and lack of exercise is definitely one health behavior, right, that can lead and can continue that pattern of health outcomes. But then I realized a lot of that was also part of the housing and the environment that I lived in, the social environment. Maybe I didn't feel, you know, for many times I didn't feel safe to walk around there. There was some barriers there, there's some pieces of that. And part of that goes into, again, the root causes of health, which are the tree roots that you name here that are a lot of the isms, right? Maybe I have experienced certain sexism in the outdoors, so I have some trauma related to that as an example, right? So that then pertains to that piece of like not me feeling safe in the social environment or outside. And then it leads me to again, to the leaves of there. There's an example of that really when we're looking at PSE work and health equity, we really have to dive deeper into things that we might not see. And one big one is the underlying systems of dominant culture narratives. And again, we mentioned it, and this could be definitely the other training when it comes to what are some dominant culture narratives, but part of that includes those biases, those stories that we're told about a community of why they have all these health outcomes, but in reality, there's more to it. So I wanted just to share this visual that for us to look deeper, that social determinants of health supports that work, but really we got to continue to dive down deeper of what is causing all of that. And it takes time. It takes longer because many people in power, when they may have some, again, dominant culture narrative of why a community has a specific health outcome, when part of PSE work is to uplift and change that narrative. There. I shared a lot, so I wanted to pause and see if there are any questions and confusions. Allison, do you want to add anything to this part?
Did great. I've used this visual just because it is helpful for folks when you're trying to talk about PSE change, and it's kind of like we need to work on some of these things that you don't always see, think about.
Yeah, and we say the beauty of PSE work is to dive deeper and again, to build those relationships in the community and humanity of everybody that we're trying to make this change for the better, knowing that there are, again, underlying structures and systems that still have to be changed, but one more step, well, it might feel small, one step towards PSE is actually pretty huge and big. Whether it's from a community coming together, and I think Margie mentioned one parent saying, I need a light in the park to be able to feel safe, to now having 30 parents sort of join. It really starts with that one narrative and one space to make the PSE work. So we're gonna go to the next slide. And we wanna give you all time and space to come together again. So we're gonna break you onto small groups. This time, we're gonna do it a little different. We're gonna do breakout room space on social determinants of health domains. So whether it's the neighborhood and built environment, healthcare, economic stability, etc. So you get to choose which breakout room you get to go into. And we would like for you to, again, introduce yourself if you haven't met each other. Talk about what some PSE strategies that you are doing or want to work on. Again, you can talk about what you're currently working on or the vision, and we want you to make the space, again, a brave space to envision something you want to see. And as you're talking and thinking about these strategies, we want you to keep in mind these questions, and these are coming from Leading with Race and addressing oppression framework from DPH that we have worked on. Who benefits from these strategies? Who is harmed? Who is influencing these strategies? Who decides on that? And then what are the unintended consequences? If all these questions are allowed, don't feel pressured to answer them. We want you to at least have this framework and set of questions to help you think through these strategies.
All right, welcome back. It seemed like y'all were having some amazing conversations in those smaller groups. We would love to hear what y'all were talking about. So maybe we want to start with the health and healthcare group, what y'all were talking about. So again, it can be the PSE changes that you are or want to work on, and kind of how are you keeping in mind these questions?
Okay, so I was in that group.
Excellent.
And there were 5 of us in there. And everyone was working on a policy per se, but we were able to kind of walk through the challenges of existing policies and like barriers. And we kind of went through some questions that you had provided. So among the answers were the challenge of identifying underserved populations and then affording them access to healthcare. Another identified like the issue of closing the loop on some work that's done, for example, when there are like screenings and there's a positive screen, and then how to connect that person to the provider that's needed to follow up. Or there could be coverage limitations and healthcare coverage limitations for people. And what else? And another shared with regard to access to healthcare and like feeling safe, populations feeling safe in a space, and potential language barriers. If it is that there is not a policy, for example, that assists in languages, or just feeling like this is a good place for a person to find it, seek healthcare. And last was, there was a policy that's kind of in the works, underway in a community, and it's just making sure that all of the stakeholders are at the table to be sure that there are no unintended consequences. Maybe that's too vague, but that's overall, that's kind of the summary of a small group.
Thank you, Monica. Are there any questions from others that were not elected or anybody else in the group that wanted to chime in? If not, we'd love to hear from the neighborhood and built environment group.
Report out. So we took the approach of having each member of our group give an example of a PSE strategy or a potential PSE strategy that they're pursuing in their world, and then taking on one or multiple of the questions. And so we heard about a bunch of different things. We have a participant from New Jersey who's thinking about how to include residents who have survived cancer into a housing project that's being developed to make sure that their voices and their perspectives are included in that design. We had a participant from Somerville talking about different safe streets policies that they've put into place following some sorry, what's it called? Disasters that happened where people were not safe and were killed in the streets. And I'm trying to think of other examples too. I'm sorry, I'm faltering to remember. If anyone wants to jump in and fill in the gaps, please feel free. So we talked about a bunch of different examples and about how to include people in the decision making, whether that be community members or how to get buy-in from municipal stakeholders. Anyone feel free to jump in if you want to add more.
Thank you, Anna. And again, if anybody has questions in our group, you can share or put it in the chat. And our last group that we had was the social and community contacts. Anyone from that group would like to share any highlights? Renee, we can see you all were very engaged in talking.
We also took the approach of having different people talk about things that they tried in their communities. The most memorable one to me was, because it's something similar but my community's doing, is trying to spread the word about the Healthy Incentives Program. We also talked about a tobacco issue in a community and trying to get nicotine out of the community, and about one of the unintended consequences or unintended harms is that this can harm shop workers or shopkeepers who profit greatly from tobacco. That's not something I thought about before the conversation, that you'd receive lots of pushback by people who make a ton of money.
Thank you for sharing that. Any other member of the group want to share anything? We hope again that this space became a space, a brave space, a space that you can dream, chat about some challenges and opportunities, and again, get to learn. We hope that the framework questions, again, of who benefits, who's harmed, who influences, who decides, and what are the intended, unintended consequences it's a tool for your toolbox, right? How we mentioned, for you to take to continue to plan your PSE work. I wanted to pause and see if there are any overall questions of what was shared since the beginning of our training. Any lingering, any confusion, anything that may come up that you wanted to share, or you wanted to bring in a strategy or dream up to the whole group that we can all uplift and help support. It feels like Allison, we did a great job today, buddy. Got it. We.
All right, well, in that case, we are around for questions because we want to provide this space. We're gonna put the feedback form in the chat. Please fill it out. We do take it into consideration and use it to improve trainings and offer different trainings. We will also send this link out via email. We are now on LinkedIn as an actual page, so please feel free to find us and follow us, and reach out at any time. Oh, it's like I say things and they magically appear in the chat. Thank you, Victoria. But Cynthia and I are here. If you all want to ask any questions, please, we're here. We have time. I'd love to answer them. But otherwise, have an amazing day.